How's it going? I'm Barnett. I'm the financial planning specialist here at Wiser Wealth Management. Just gonna take some time today to discuss Medicare and Medicare planning. So Medicare, as you know, is a government-provided health insurance that you're eligible for at age 65. It's important to realize that there's usually a 7-month window on when you would apply. So you would apply either 3 months before, during the month, or 3 months after that you turn age 65. The only caveat to that would be if you are currently working at a firm with over 20 employees, you could wait until you retired from that company to go on Medicare. However, if you work for a company with less than 20 employees, at age 65, you would still need to apply for Medicare as your primary insurance. Then after you retire, you have up to 8 months from retirement to apply for Medicare. Medicare Part A, as long as you've had enough credits through Social Security, you would qualify for that. But Medicare Part B is what you really need to apply for when you're applying for Medicare. If you're currently on Social Security, you would already have applied for that. But if you haven't applied for Social Security, you would need to apply for Medicare Part B. Medicare Part B is for more of the doctor services. Medicare A is more hospital outpatient care. So there's various ways that you can look at Medicare coverage. So you could go the government route, which would be like I mentioned, Medicare Part B, which has some premiums. So Medicare Part B is based on the 2 years previous year's earnings. So if you're currently below $176,000 joint or $88,000 as an individual, the Medicare premium will be $148.50, and that'll be deducted from your Social Security. The IRMAA taxes on that start to increase significantly in each income gap above that. So that's why we're doing Social Security planning as well as a Roth conversion analysis for retirees. We're trying to look at making sure that we don't increase their Medicare Part B premiums as well. Besides A and B, there's also Part D, which is prescription drug coverage. There's also an income component to the premiums on that as well, although it's not as significant. And then usually there's a loophole there in some coverages where you'd have an additional out-of-pocket cost. So clients would want to usually apply for a Medigap policy or a Medicare supplement policy. Same thing, just interchangeable terms there. If you did not want to go down that route, you could always just apply for a private health care coverage through Medicare Advantage. It's also a lot of times referred to as Medicare Part C. So a Medicare Advantage plan would be an all-inclusive plan. Usually has lower cost to it. However, if you were to really like your doctor and you need coverage elsewhere, it does not provide for out-of-coverage health care as much. So the biggest issue there is there's health issues within your family. Going out of network is a big issue with Medicare Advantage plans, or if you're out of town and needing health coverage, there's other issues there. So while it might seem like it's more cost efficient being all-inclusive plan that's lower cost, that's not necessarily always the case there. If you do decide to go Medicare Advantage route and later decide that you'd rather go through the government's plans with Medicare, original Medicare plans, that is always an option during open enrollment. However, they're not guaranteed if you do have health concerns to be able to be provided coverage through Medigap policies. So it's something that you need to look at there. And it's very important when you're applying that you look at the different scenarios for Medicare as well. If you do have Medicare plans through A, B, Medigap, and D, every year you would want to make sure and renew and speak to a consultant about what is actually covered under Medicare Part D, because prescription drug coverage is changed yearly. So you want to make sure that you have ample coverage there and that the prescriptions that you're on are covered through Medicare Part D. So it's going to be a very confusing process. We're here to help clients and prospects along through this process as they turn 65 or later, as they're looking at various coverages. But this is also something you can look at through a healthcare consultant yearly, making sure that annual coverages are appropriate. If you have any questions for us, feel free to reach out to us or go to our website to learn more. Thank you.